Mr. Chairman, for allowing me to be here on this panel today. This is a very important conversation that we're having here, and I think that all the colleagues in front of me have covered much of the issues that I had in my mind, but I want to go back to and follow up on the conversation that Representative Noem has talked about, where there's been this diverting of this money. The IRS, in fact, has spent $1.2 billion on implementing the President's health care law. Is that true?
Over the last 4 years, we've spent $1.2 billion. It's a statutory mandate. We have no choice.
$1.2 billion. And in addition to that, you expect to spend another $533 million in FY 2015. Is that correct?
That's correct.
Okay. So that's almost 5% of the IRS's total budget.
Correct.
Is that correct? So what we see here, and I understand that you're saying it's a mandate on your agency that you must follow the law, but I think it's important for the American people to see what this is costing the American people, that $1.2 billion has been spent up to this point in time in implementing this law. And so when we talk about the cost to the American people on implementing this law, this is one that I think gets many times lost in that conversation. The American people don't realize that this is how much money that's being spent just on this side of implementing this law. Now, I want to go on and connect this into something last week in one of my health subcommittees, as we were had people who are in the real working world, employers who are having to abide by the law on the employer mandate. And one of their complaints is that, first of all, they did not receive the guidance on just how to report on the employer mandate, which they are going to be required to do in FY 2015, to report the employees that they have, the amount of insurance that they have for them, their families, Social Security numbers. A lot of information is coming to you. They did not get guidance on that until February, and yet they have to go back to January and do that reporting mechanism. But here's the thing that they tell us is this is a lot of work, costing them a lot of money. Can you tell me if the agency is ready to cross-match what they're sending in with what's seen on the exchanges, and whether these employees that they have possibly have somebody in their family that's applied for the exchanges and the subsidies? Can you cross-match this information? Do you have the system set up to do that?
We don't yet. That's what we're building this year. That's part of the challenge for preparing for the next filing season. But we are prepared. I've been meeting every 2 weeks for the last 15 months with the IT people, the program people, and our operations people, reviewing the deadlines and the timeframes. As I say, we managed to get through this filing season with all the ACA implementation going smoothly. We expect to get through the next filing season going smoothly. But again, it's a challenge, and to the extent the funding continues to be cut, it's going to be a significant challenge.
So what we can say to the taxpayer is, by the way, you couldn't get into the IRS to ask your questions because money was taken out of customer service and put over here to the implementation.
Well, another way to put it would be we couldn't get in the IRS because, in fact, our budget was cut on top of all of that.
And in addition to that, we're asking employers to spend a lot of time putting all this information into the system where, admittedly, the system is not even ready to use that information to do what the system says that they are requiring them to send this information in for.
We will be ready by the filing season 2016. Last year I said we would be ready for filing 2015, and we were. And I'm confident, because it's a great workforce working very hard, that we'll be ready to use that data when it comes in appropriately in the next filing season.
Well, I certainly hope as we look next year this time and we're talking about this, that is true. You certainly said it here for the record, but it is a lot of information that is causing employers a lot of time and money to put in. And if this information is not being able to be used, and again, we're taking this from customer service, moving it over to the implementation of a program that, again, the American public, I don't think, realizes how much this is really costing. Thank you, and I yield back the balance of my time.
Thank you. My only other